Hello everyone, it's Dr. Nikki, the board certified family nurse practitioner back in the house. I hope you're all well and you're staying safe. In today's episode, I will be talking once again about recommended health screenings and vaccinations for adults. Recommended health screenings and vaccinations for adults. And the reason why I'm talking about that again today is because there have been a couple of updates to some of the vaccines. All right, so let us get started. In accordance with the U.S. Preventive Services Task Force and current guidelines, the following screenings and vaccinations are recommended for adults. Flu vaccine. We all know about the flu vaccine, influenza vaccination, or flu shot, as some people will call it. It's recommended for all adults, and it's one dose every flu season. All right, so talk to your doctor to see if you are eligible to get the flu shot, if it's not contraindicated for you. All right, hepatitis A, hepatitis B. We have vaccines for both. We do not have a vaccine for hepatitis C. All right, so hepatitis A vaccine is for all adults who want to be protected, and it's 2 or 3 doses depending on the vaccine that you get. The same thing with hepatitis B vaccine. All right, so all adults who want to be protected, and if you have chronic diseases such as liver disease, diabetes, if you are on dialysis, or if you have kidney disease or renal disease. All right, so it's 2 or 3 doses depending on the vaccine as well. Hepatitis A vaccine is important. A lot of people will get that when they travel out of the country, because you can get contract hepatitis A through contaminated food or water. Hepatitis B is through blood. All right, contaminated blood, maybe IV drug users, things like that. All right, so if you want to be protected, please get your vaccine. They may want to do a titer on you first for hepatitis B to see if you are immune, and then if you're not, then you get the vaccine. All right, and it comes in series as well, so 2 or 3 doses depending on the vaccine that you get. So the update that I have is for the pneumonia vaccine. We have talked about that in the past. Pneumonia, there are 2 of them in the past, which was the pneumonia vaccine, which was the Pneumovax, and then we had Prevnar 13. So now we have an update to the Prevnar. We have Prevnar 15 and Prevnar 20. Prevnar 15 and Prevnar 20. All adults 65 and older should discuss and decide with their provider about this vaccine. All right, and of course, if you are less than 65, between 19 and 64, if you have a weakened immune system, you should also discuss getting this vaccine with your primary care provider as well. All right, so for Prevnar 15 and Prevnar 20, 1 dose of Prevnar 15 is recommended, followed by the Pneumovax, or 1 dose of Prevnar 20. So you get 1 dose of Prevnar 15 followed by Pneumovax, or 1 dose of Prevnar 20. And then for the Pneumovax, which is also another pneumonia vaccine, all adults 65 and older, it's recommended for you guys. All right, 1 dose unless directed by your primary care provider. Okay, so those are that is the update. So remember, we had Prevnar 13 before, so now we have Prevnar 15 and Prevnar 20. And for those 65 and older, please discuss it with your doctor. And then if you are younger than 65, if you're between 19 and 64, but you have a weakened immune system, discuss that also with your provider. Okay, now we have the shingles vaccine. There was an older version before, which was called Zostavax. Now we have Shingrix. So Shingrix is the newest shingles vaccine out there, and Shingrix is in 2 doses. All right, so adults age 50 and older, it's recommended that you get the shingles vaccine, which is the Shingrix. 2 doses, they're spaced out 2 to 6 months apart. Right, you get the first one, and I tell you to come back 2 to 6 months later for the second one. Okay, the older version of the shingles does not count as one of the new one. You have to get a new set of 2, if that makes sense. All right, now we have the tetanus, diphtheria, and the whooping cough, which is the pertussis vaccine, which is Tdap, or tetanus vaccine, which is the TD. All right, so Tdap, TD, all adults needs it. All right, all adults should get it. And then it's 1 dose of Tdap, which is a tetanus, diphtheria, and the whooping cough. It's a 3-in-1 vaccine: tetanus, diphtheria, and the whooping cough, or pertussis. 1 dose of the Tdap. Then TD, you get a TD, which is a tetanus vaccine booster every 10 years. So remember, if you're an adult, you need to get a TD booster every 10 years. All right? Okay, and then we have HPV, human papilloma virus vaccine. It's recommended for adults age 27 to 45. Age 27 to 45. 3 doses. Okay? Please talk to your primary care provider. 3 doses, talk to your primary care provider. All adults 27 to 45. Remember that this episode is strictly for adults. Children also, they have their own vaccines, all right? But this particular episode is for adults. Children can get the flu vaccine if they're 6 months and older. Children also get HPV vaccine, but we're not talking about children today. We're talking about adults. All right, so as I said, HPV, which is a human papilloma virus vaccine, adults age 27 to 45, and there are 3 doses. Please talk to your doctor about that. Now we're going to go into so we finished with the vaccinations. We're going to go into the health screenings, the recommended health screenings. The first one is colonoscopy, all right, which is a colon cancer screening. We have, under colon cancer screening, we have a few types of colon cancer screening tests that you could do. The most common one that everybody knows is the colonoscopy, but it's not only the colonoscopy that you could do. So depending on your situation, depending on your family history, your risks, then please talk to your doctor about the one that is suitable for you to do. All right, but colonoscopy is the most common type of colon cancer screening that a lot of people do or know. Okay, so colonoscopy every 10 years, if everything is well, if you don't have polyps, if you don't have a family history of colon cancer, or if you don't have any kind of issues. It's every 10 years, but everybody is different. This is just a general guideline for all adults, but each person is different. Your situation is different from another person's situation. What I qualify for may not be what you qualify for. What is suitable for me may not be suitable for you. And that is why care is individualized, and you should talk to your own primary care provider, because your friend may be getting a colonoscopy every 10 years and your doctor may tell you to come back every 5 years or even every 3 years to get yours done, and you'll be like, why? My friend was told to come back 10 years. Situations are different, so please follow up with your primary care provider. But the regular guideline is that colonoscopies should be done every 10 years. But as I said, situations are different. They may tell you to come back every 3 years or every 5 years, depending on your own particular situation and health history, all right? Or past medical history and family history as well. And then we have sigmoidoscopy. So colonoscopy is pretty much the whole colon is reviewed and checked, all right? And then sigmoidoscopy is only part of your GI, whatever that is checked, not the whole thing, and that is every 5 years. So sigmoidoscopy is every 5 years. And we also have CT colonography. CT colonography is every 5 years as well, all right? And then we have fecal occult blood test, which is FOBT. FOBT is every year, all right? FOBT is every year. You should get that done. But as I said, some people, the doctor will prefer you to have a colonoscopy or any other test done, especially if you have hemorrhoids, bleeding hemorrhoids. If you have bleeding hemorrhoids and you know that your test is going to come back positive because of blood in the stool, then FOBT is not recommended for you, all right? Or is not suitable for you. And then, because if you test positive with the FOBT, you will still have to end up having that colonoscopy that you didn't want to have in the first place. All right, so colon cancer screenings, adults 45 to 75. It's recommended for adults 45 to 75. Adults 45 to 75 years old. So colonoscopy every 10 years, or it could be less, depending on your own personal situation or health history. CT colonography every 5 years, sigmoidoscopy every 5 years, fecal occult blood test, which is the FOBT, every year, and then the last one that we have under colon cancer screening is the Cologuard. A lot of people have probably seen the advert on TV. Cologuard or Fit DNA. Fit DNA, Cologuard every 3 years. Every 3 years, all right? So talk with your primary care provider about when to have your next test if you have abnormal screening results or if you've had it in the past. And then if you have a family history of colon cancer as well, please talk or discuss your options with your primary care provider. All right, let's move on. Breast cancer screening. Breast cancer screening. We have mammogram. Women under 50, please talk to your primary care provider. I've seen some people younger than 50 getting mammograms done because maybe they have a first degree relative with breast cancer, or they've had abnormal past medical history of breast issues in the past or whatnot before, or maybe cancer. Please talk to your doctor if you're less than 50. But typically recommendation is for women age 50 to 75, right? Or 74. 50 to 74, you should be getting a mammogram done every 1 to 2 years. Some people get it done every year. So as I said before, everybody's different. Some people get it every year, but the recommendation is every 1 to 2 years, all right, for mammograms. Now we move on to bone density test. So for bone density test, which is a DEXA scan, all right, we have osteoporosis screening. That's what the bone density test is for, osteoporosis screening. Women age 65 or older, all right? And then if you're younger than 65 with risk factors, please talk to your doctor, all right? So it's recommended for women 65 and older or women 64 and younger with risk factors. Please talk to your primary care provider about that. At least you should have it done once, and then depending on the results, they might want to repeat it every couple of years or every few years. And then if you're on treatment, they might want to repeat it to see how the treatment is progressing and whatnot. Okay? And the next one is lung cancer screening. So lung cancer screening, which is done using a low-dose chest CT. Low-dose chest CT is a lung cancer screening. Adults age 50 to 80 years old who are current cigarette smokers with a 20-pack year history and currently smoke or have quit within the past 15 years. I will repeat that. Lung cancer screening, which is a low-dose chest CT, are for adults age 50 to 80 years old who are current cigarette smokers with 20-pack year history and currently smoke or have quit smoking within the past 15 years. You should get a lung cancer screening with a low-dose chest CT every year. Please talk to your primary care provider about that as well. All right, and then we have aortic aneurysm screening. Aortic aneurysm screening, which is abdominal aortic ultrasound. It's an ultrasound done to check for, aortic aneurysm. So, men age 65 to 75 who have ever smoked. So if you are within the ages of 65 to 75 and you've ever smoked, you should get a one-time screening for aortic aneurysm. All right? It's an abdominal aortic ultrasound that will be done. At least a one-time screening if you're a man and you're between the ages of 65 to 75 and you've ever smoked. Okay, moving on. Hepatitis C screening. Remember I had mentioned that hepatitis C, we do not have a vaccine for it yet, but you do have a screening for hepatitis C. All right, so adults age 18 to 79 years old or anyone who is at risk should at least get a one-time screening for hepatitis C. Adults aged 18 to 79 years old or anyone who is at risk should at least get a one-time screening. And also, please, if you're at risk for hepatitis C, talk to your primary care provider. Very, very important. Please talk to your primary care provider if you're at risk for hepatitis C. Okay, and then we have pap smear. Pap smear is cervical cancer screening. All right, some people say pap test, pap smear, cervical cancer screening. Very important for women. Very, very important for women. If you're 21 to 65 years old, you should get a pap only. if you are a woman and you are between 21 and 65, regardless of if you are a virgin or not, okay? If you are 21 to 65, you should get a pap test or pap smear. You should get a pap only if you're between 21 and 65, and then if you are between 30 and 65, you can add the HPV test to your pap. If you do the pap only, then you should repeat it every 3 years. If you add an HPV to it, you should do it every 5 years. But as I said before, this is just a guideline, a general guideline. Each person is different, okay? You may be told to come back sooner for the pap test or pap smear, depending on what they find or your history. All right? Please follow the advice of your primary care provider or the specialist taking care of you. So let me repeat: pap smear, which is a cervical cancer screening. If you are between the ages of 21 to 65, you get a pap only, and then 30 to 65, you can get the pap with the HPV, and then that will expand your testing to 5 years. But if you do the pap only, then you should repeat it in 3 years. Okay. And then cholesterol screening. Cholesterol screening is for anyone with diabetes, definitely, and then adults 40 and older. Okay, adults 40 and older and anyone with diabetes, you should please try and talk to your doctor about getting your cholesterol screening done. Okay, which is just a blood test. They do a blood test, lipid panel. They check your total cholesterol, your triglycerides. They check your HDL, which is the good cholesterol, your LDL, which is the bad cholesterol, and they check the ratio. All right, so we have cholesterol screening, which is a lipid panel. You should talk to your healthcare provider about getting that test done. Okay, especially if you're diabetic as well. And all adults 40 and older should be getting it done. And an eye exam, if you have any problem with your eyes, or let me put it this way, if you have diabetes, you should get your eye checked, your diabetic eye exam done every year, or even some people go every few months. All right, so this is just a general guideline. Everybody is different. If you have problems with your eyes related to diabetes, your specialist, your eye specialist might want to see you more frequently, every 3 months, every 6 months, but at least you should go every year if you have diabetes, anyone with diabetes. And then just vision screening, regular vision screening for everyone 65 and older should be done every 1 to 2 years. All right, every 1 to 2 years for anybody else. Adults 65 and older, vision screening should be done. They check for cataracts, they check for glaucoma, they check for macular degeneration, they check for any kind of problems with your eyes. All right, so that ends the recommended health screenings and vaccination. And so as you can see, there are a couple of updates to these tests. So I would want you to please follow up with your primary care provider to determine what tests you should be getting done and when you should be getting them done, because as I said, everybody is different. So your time to get a test done might be different from my time, because you have your own family history, you have your own health history to consider when discussing all these tests or screenings with your doctor. All right, I hope this helps, and I hope that you would take your health very seriously this new year, 2023. And please don't forget to share this episode with friends and family, and I'll catch you in the next one. Take care. Bye-bye.